You should see a message. We are going to be recording this. I apologize that I just remembered that, so I do apologize. So today we're going to be, I would encourage you to put your screens in speaker view so that the speaker is the biggest image on your screen. It makes it a little bit easier to follow along. Tom today is going to be taking us through some exercise techniques to ease pain. That sounds really good. Noelle is going to be talking about the health benefits of water, and I was just chugging down my 4th bottle full today. So been working really hard on that. And Nancy is going to talk about yoga stretches for shoulders, neck, and hips. And I know a lot of us carry our stress in our shoulders and our neck. So I'm looking forward to hearing more about that. And Tom, I'll let you take it away.
Well, thanks, Denise. Thanks, Deb. So today, this is probably one of my favorite topics I get to talk to you guys about. I've had, with strength training, cardio, stretching, this technique that I'm going to talk to you about, I've probably had the most success with, and that's self-myofascial release techniques. If you don't know what that is, it's foam rolling. And you can use various different things. I'm going to show you a few things that you can use for foam rolling here. But you can do it in the park, in your office. You can do it right in, the gym. But what is self-myofascial release and how does it work? Self-myofascial release, or SMR, is a great way to improve flexibility and mobility of tight muscles and restricted joints. It works on 2 principles. 1, it breaks up facial adhesions, and 2, it manipulates certain neuromuscular receptors to let the muscle release so it's not so tight. When should you do it? I like to do it right when my clients are done warming up. You can do it before or after too, but doing it before, it helps, get those trigger points. It helps those muscles to warm up, promote more blood flow to the muscle group. One of the stories I want to share real quick before I get started is I had a client, when I started with them, I said, we're going to warm up for 10 minutes. In the next 2 months, twice a week for an hour, we're just going to foam roll. And that client was like, what the heck are you talking about? And he thought it was for sissies and everything. And lo and behold, the client realized that it was no joke, and his flexibility increased huge stories, amounts on that. So some of the things I like to use for foam rolling, of course, we're going to do, the big foam roller here. If you don't have something that big, you can use a smaller one. If you look closely, these have like little fingers on there, and that's for helping with a little bit deeper tissue. And of course, you can use a tennis ball. This is kind of a lacrosse ball that I like to use to dig down deeper into some of those joints, bottom of the feet, helps out too. So with that, I'm going to get started on that, some of the techniques that you can use, and we'll go from there. Let me adjust my screen. So like I mentioned before, I like to start out using, when I do any type of stretching or foam rolling, is starting out at the calves and working up to the upper body. So what I'm going to do is 2 ways. You can put 1 foot over the top, or you can just keep 1 foot on the side, and you're going to just roll that muscle out. And what you're going to do is roll until you find a spot where it's sore. And yes, you may scream on that, but don't worry. Just back off a little bit. And when you find that sore spot, like right there, I got one, I'm just going to hold it right there for about 30 to 45 seconds until I start to feel that breaking up. And I keep on going back and forth, rolling all the way up to the joint, but you don't want to go over the joint. You want to just roll that muscle out. And I'm rotating my foot. Get a better view here. I'm rotating that foot on the side and in the inside. And you just keep on rolling until you find. Then you hit the other side, back and forth. And you will feel like when you're rolling, you will see that you might feel that knot moving back and forth. It's probably the size of a boulder and like a marble or a golf ball. Just keep on hitting that spot until it rolls out. You're not going to get them right away. It's going to take weeks and months to get those rolled out. Then the next one I like to do is the hamstring. Just rolling the back of the leg up to the glutes. And for me, I don't necessarily have a lot of knots. I don't feel them in my hamstrings, but mostly for me, it's the calves, the quads, and the glutes. So after that one, you're going to want to roll over, and you want to get your thighs. And one thing is, what I like to do is I like to lift up, like if I'm rolling up my right thigh, I'm gonna lift up my left hip just ever so slightly. And I'm rolling. My feet are on the ground. And I got a lot in this one, I can tell. Rolling right up to the knee and back. So I feel it right there. So I'm just gonna hold that for a little while till I feel it start breaking up. And keep on going back and forth. So I'm rotating, hitting that thigh in all different angles. And I'm going to hit the other side. Main thing on here is that you keep on breathing. You don't want to hold your breath. And you can buy a lot of these foam rollers right inside the stores, Walmart, Meijer, Dick's Sporting Goods. You can get them online. The bigger rollers, I got this at the foam factory down on Hall Road, which they've moved now. I think they're on Grossbeck for, this was like $18, 3 foot by 6 inch. That was back probably about 8 years ago that I got that. Some of the smaller ones can run pretty expensive, but the 18-inch ones that we have at work are about $15 to $18. Those are pretty good ones. So the next one is the glutes. So I put the side I'm going to roll, I put that leg up, and I'm just going to roll to the lower back and to the glute. And this really helped me a lot when I was having some sciatic nerve issues about a year and a half ago. And so I really try to roll out my glutes a lot so that doesn't tighten up in there and keeps me loose. Also with foam rolling, it's going to help with your posture. As you know, and Nancy will explain this too, she's already explained it in the past weeks, is that when you have tight muscles, it affects your posture where you may lean forward, which will lead to lower back pain. You may have rounded shoulders, which will lead to upper back, tightness in the shoulders. And then you're going to have that turtle look where your neck is stretched out. That's all because a lot of that is tight muscles, not lack of dehydration and so forth there. So let's get the other side. That's all feeling pretty good. So the next part, and I want to stress on this, is really when we start to work the back, is really be careful on rolling out the back. You don't want to go too much on there. So I start out with my lower back. You may hear some popping and cracking, which I'm doing, just realigning myself, rolling out. The main thing here is you do not want to roll on your neck with your hips up in the air because you're just asking for neck issues on there. I'm rolling out my back here, rolling up to my lower back. That's all feeling pretty good. With now this next one, you can roll right through here and get your sides of your back, which are your lats. Right there. And then of course you're going to get the other side. Another tender spot, and this is a lot for runners, is the IT bands. So what you're going to want to do is go to your elbow, go right inside your hip and bring that other foot across. I'm just going to roll out my IT bands. I'm rolling all the way down to my knee. Remember again, do not go over the joint. Okay, let's hit that other side. Now we can hit the inside of our legs here, our groin area, to get the other part of that thigh in there. Of course, I'm going through these pretty quick, but you're going to do these anywhere from 30 to 45 seconds to roll out. Go through the series of your whole body once, and if you feel like you need it again, go through it again. Now, the last one I like to do, which this really only works with the long foam rollers, is I sit on it, and I like to lay down on here. What I do is palms up and just let that chest open right up. And feel the stretch, and try to think of my quiet spot. For me, that'd be sitting on the beach here and the waves crash. And true story on this is one time when I was with a client, this is a little embarrassing, but I got so relaxed on this thing, I just about fell off the edge of it, because that's the main things you want to do, is you want to really relax, open up that chest. Because so many times we're at the computer typing and our shoulders are rounded. By laying on that back, palms up, that really opens up the chest and relaxes you on that. So for that is everything I have for myself. Again, you could use a 3-foot, you can use a small 12 to 18-inch foam roller, which is really nice. And the cool thing about this one, guys, watch this. It collapses. I can fit that right in my backpack. I take that and I use that with clients, and then I don't even know it's there, so I don't have to carry a big foam roller with me. So, but anything of those will work out. Now I'm going to turn it over to Noelle.
Thanks, Tom. That was really helpful. Let me try to adjust this so you can see it all. Okay, cutting me off a little bit, that's all right. So I'm talking about hydration today. It's a good time of year to be talking about this, especially this last 2 90-degree days. I think we all know that our water needs increase as it gets hotter out. So we do have a big problem in the US, really across the world, with people not drinking enough water. Countless surveys have been done. There's a recent one that showed 7% of adults are drinking absolutely no water in a day. Only 22% are drinking 8 or more cups a day, which is not even really enough for most of us. So about 80% of us at any given time are walking around dehydrated. So humans are 60% water. Therefore, fluids are crucial for literally every single system in our body. So I'm going to briefly go through kind of each system, just give you some of the benefits of hydration. Some nasty things can happen with dehydration. Hopefully encourage you to drink a little bit more water. Hopefully everyone has some in front of them right now. So I'm going to start with the kidneys. The kidneys are crucial for water. They maintain our fluid balance. They actually filter all fluids that go through our body, and they filter much of the waste and toxins in our body. Excess fluid and waste are sent from the kidneys to our urinary tract. And this is so it can be removed or excreted in our urine. So every single time we urinate, we're flushing out excess waste and toxins. So a lot of people, especially clients that I have, don't want to drink more because they're going to pee more and they don't want to take the time. They find it annoying to have to go to the bathroom all the time. And I feel you, because the more water you drink, you'll definitely notice you're peeing a lot more. But that's the whole point. You want to be urinating frequently because every single time you do, you're flushing out that waste and toxins. So it's a good thing if you have to go to the bathroom a lot. So adequate hydration is going to prevent kidney damage because water helps dissolve nutrients, and it also helps the kidneys remove the waste products. So we need adequate water so the kidneys can do their job. Severe dehydration, or UTIs that can be caused by severe dehydration, can result in acute kidney failure. Sometimes this is permanent, and I have seen in the nursing home and in the dialysis center where I used to work, we would have people severely dehydrated, result in acute kidney failure. Their kidneys just never recovered from it, so they were on dialysis the rest of their life. So it can be very serious. That's obviously a major example. I don't want everyone to think with mild dehydration you're going to have acute kidney failure. Chronic dehydration, though, over time, especially decades, can result in kidney stones and chronic kidney disease. Chronic kidney disease can then progress to kidney failure. Now, the kidneys also regulate our electrolyte levels, so potassium, phosphate, and sodium in our body. These electrolytes carry electrical signals between our cells. So if we have an imbalance in our electrolytes because we're dehydrated, we can have seizures, involuntary muscle movements, loss of consciousness. All right, so that about covers it with the kidneys. We're going to move on to brain health because we're CMH. Hydration is crucial to the production of hormones and neurotransmitters, which is crucial to have well-functioning mental health. Dehydration can affect brain structure and function. Prolonged dehydration is shown to affect thinking and reasoning. So if you're dehydrated at work, you're not going to be on your A game. It also can cause anything from a mild headache to a full-blown migraine. I think a lot of us have had the side effects of having a headache when we're not drinking enough water. Weight loss. So weight loss and hydration go hand in hand. If you ignore thirst for too long, your body will assume it's not going to get the water that it's asking for and will instead start to send out hunger signals because it knows it's going to get some fluid if you do eat food. The body's very tricky. So dehydration also slows down our metabolism. There's a really interesting study where they had people drink a cup of water before each meal. They found that people increased their metabolic rate by 10 to 30%, meaning they burn 10 to 30% more calories just because they had water before meals. So that can be huge. It can definitely help with weight loss plateaus. And it's something we definitely talk about with InShape and with our people working with us to make sure they're well hydrated in their weight loss efforts. Our joints. So the cartilage that makes up joints in the spine is actually 80% water. And it helps to lubricate the joints. So dehydration is going to reduce the ability of the joints to absorb shock like they're supposed to, which leads to increased pain. So a lot of your pain could just be because you're dehydrated. Our mouth. So every time we take a drink of water, we're rinsing off different bacteria that build up on our tongue, build up on the teeth. So that's one way water helps. Water also helps form saliva and mucus, which keeps our mouth, nose, and eyes moist. So all those passages. And then our airways also will become restricted with dehydration, which is purposeful from the body. It's an effort to reduce our overall water loss, but that can trigger symptoms like asthma if you have problems with that. Our blood. So our blood's 90% water, almost all the water. It's responsible to deliver oxygen to all parts of our bodies. It also, vitamins and minerals dissolve in water and are transported through our body through the blood as well. So if we do not have enough water, that makes our blood thicker, that makes it harder to deliver oxygen, to deliver vitamins and minerals, and it also results in an increased blood pressure. Thicker blood means increased blood pressure. So a lot of issues with the blood if we're dehydrated. Skin. I'm sure a lot of women in particular listening have heard that you need to have adequate hydration to keep your skin looking moisturized. So water helps keep our skin plump on a cellular level. It also helps with elasticity. So this improves our appearance. It also can combat wrinkling. Our body temperatures, one of the main reasons that we have so much water is that we are going to sweat when we're hot, and this cools us off when it's evaporated. So if we're dehydrated, this isn't going to function properly, which results in a decreased ability to handle heat, which is not good, especially in those hot days, and can greatly increase the risk of heat stroke. Our bowel, so a common symptom of dehydration is constipation. We see this all the time in nursing homes. It happens especially in the elderly because a lot of times they aren't drinking enough water. You do need water to have regular bowel movements, which is a very important process. That's another way our body eliminates waste and toxins along with the urine. And then ability to exercise. Another study I found that athletes had reduced performance when dehydrated. So if you can't tell already, water is going to affect every single system that you have. So talking about requirements, general guidelines have increased for water. You probably have heard of the 8 cups a day or 64 ounces. So that's kind of lower than what we recommend now. We recommend 100 ounces or 12.5 cups for men, 73 ounces or 9 cups for women. Another easy way to do this is take your body weight in pounds, just divide it in half. So a 120-pound woman is going to need at least 60 ounces of water. And I would say if you're doing this method, you want that number of ounces from water alone, because that's probably still not going to be quite enough, and at least you're going to get some more through food and through other fluids. Another way is to just look at your urine. If you're colorless or a pale yellow for your urine, you are good to go. If you have anything darker than that, especially when you're getting to those dark brown colors, that's a big problem. You're gonna definitely wanna drink some more water until you can get to at least a pale yellow. And this should be on a regular basis. At no point in time should your urine ever go past the pale yellow. Things we want to avoid. So there's still a debate on if caffeine-containing beverages are going to act as a diuretic, meaning that it will pull water from our body and make us urinate more. So a lot of studies have found that this effect is pretty minimal. We actually absorb a pretty good amount from caffeinated beverages. So that can count towards your total fluid goals. The thing to avoid would be empty calories in juices, Gatorades, all those sports drinks, really, unless you're like an Olympic athlete. Pop especially, that's a huge one. You're still going to be hydrated, but it's kind of, it's not really helping you out in the weight loss department if that's one of your goals. And then alcohol does have a dehydrating effect. So if you're drinking alcohol, you always want to make sure you're following up with 8 ounces of water per drink that you have. And then, like I mentioned at the beginning, our needs increase based on hot weather, especially how much we sweat, fever, vomiting, or diarrhea. So if you have any of the above, or you're sweating a lot, working out a lot, you're going to need more water. Okay, I think we covered that part. So what I have going on here is some infused water recipes. Now, infused water, there's a lot of stuff floating around that it's going to rev up your metabolism or do other crazy benefits, really help with weight loss or something. That's not, we don't have good studies to prove that that's true. Maybe it is, but we just can't prove it right now. The main point of infused water is just to keep you hydrated and all the benefits we just talked about with hydration. So you are going to get a little bit of benefits, like when it comes to lemons, high in vitamin C. Vitamin C is a water-soluble vitamin, so the longer it stays in the water, the more vitamin C that will leach out and dissolve into the water. So you might get some benefits that way. It's not going to be a super high amount. Lemon water isn't going to completely boost up your metabolism like they say. That's probably just the benefit of water itself, as we already know. So I was going to show you how to cut lemons and limes. I figure everyone knows how to cut it, but if you don't, you just want to cut off the ends. This is going back to my bartending days. So you got the end cut off, then you want to stick it like that, stand up vertically, cut it in half. And from there you can make your wedges. I usually try to pull all the seeds out before I do this because I don't like having them in my water. Another thing I should mention, some people get concerned, especially when you're adding fruit like strawberries and pineapples to water, if the calories and the sugar count, especially because they can taste really sweet. Most studies have found it's pretty non-existent as far as calories and sugar go, so I wouldn't worry about that at all. So we're just going to start adding them here. One of the first things I did, I already put ginger puree in here. This is just from the store. You can also use powdered ginger. Now this one I will say has benefits beyond hydration because ginger is anti-inflammatory, and there's studies proving just 1/8 teaspoon of powdered ginger is as effective as ibuprofen in reducing headache and pain. So this one might actually give you some more benefits. So this is ginger. I'm going to throw in lemon, and I think I was planning on lime. So you can leave it like this, just fill it with water. You can also take, this is a mortar and pestle if you've never used this before. My husband makes fun of me because I had to have it. This is probably like the second time I've used it in 2 years. But this thing is very useful when you're muddling drinks. You can just kind of smash down in, release the juices, speeds up the process a little bit. And then if you add room temperature water, you're going to leach more flavor, you're going to leach more nutrients. So I would add room temp water at first and then add ice whenever you plan to drink it. You're going to want to let this steep at least an hour, or you can just add it to your fridge and let it steep for as long as you want. If you leave the fruit in here, it's going to be good for about 3 days. Just kind of look at it and make sure if you take the fruit out, it will last pretty much however long it takes you to drink. So I'm gonna do a couple more flavor combos. I think I planned, this is mint. It smells really good. And then I was gonna add some watermelon. Same thing, especially when you have mint or any leaves like that. I would muddle it a little bit just so you can start breaking down the plant. Strawberries. I was gonna do strawberries and pineapple. That's my favorite combo. It tastes like candy. But when I pulled my pineapple out of the fridge, it was not looking too good. So we're just gonna do strawberries, and I think I was gonna do lime with this one. And we'll put in a lemon, because why not? Then I have some cherries. I didn't cut these up, so I'm just gonna press them a little bit. These still have the pits in. I'm just gonna make sure when I'm drinking, I don't have those. All right, so we got cherries and lime. What was the last flavor I was gonna do? Oh, I think I was gonna add cucumber to this first one, and I totally forgot. Cucumber can be really good in water. A lot of people are apprehensive about that. Oh yeah, the last one. So this one is the only one I haven't tried. But I have my basil plant here, so I'm adding strawberries and then a couple basil leaves. I'm not sure about basil and water, so I'll give it a try when we move on to Nancy, and I'll let you guys know how it tastes. This one will be new for me. Again, I'm gonna muddle it just a little bit to break down those leaves. Let's make sure I didn't forget anything. I think we got it all. All right, so hopefully that helps a little bit. You can try some of those recipes. They're really nice in the summer, especially with a lot of ice. And hopefully you have water in front of you. We'll take a drink now. Let me come back up here so I can turn off my mic and move on to Nance.
Oh, there we go. I thought I was talking. Every time you do one of these, I want to come over to your house and try what you're making. It always looks so good.
Yeah, I have a lot left over. Feel free.
I think that I learned a lot about water when I was coaching runners, and there's no reason not to take care of yourself, and that's one of the easiest ones to do. There's also an app I used to have on my phone when I worked full time that would remind me to drink, because sometimes when you're working, you forget. And I don't remember the name of the app, but I'm sure that all the computer savvy people will find it. And it just helped, because you get in meetings, you have people talking to you, you're doing things, and you don't remember to drink. So that was really helpful to me when I was working. All right, I'm glad to be back with everybody. I hope you have some room to stretch out a little bit. You're gonna need to today. Like Tom, I'm a big foam roller advocate. I always have one. My family will tell you I keep it on the floor in the living room. So if I'm watching a movie or something, you might find me on the floor watching the movie with my foam roller, rubbing out whatever I have accumulated in tightness during the day. Before we start, I want to say you do not need a yoga mat to do yoga. You can do yoga on a blanket. You can do it on a short rug that's close to the earth. I'm teaching yoga in Yale right now outside in the grass, and that's kind of fun too. You don't need a yoga mat. So they're nice to have, but they're not necessary. I got these really inexpensive yoga mats at that Five Below store at the mall, and they really were $5, and they've lasted for 4 years. So if you get one of these and you keep it clean, they will last for a really long time, and they're not super expensive. The other thing that a lot of yoga instructors will ask you to do is bring a strap, so it helps you when you're doing stretching. And the straps are really expensive. They're like $15 for a strap. I went to the thrift store, and someday we'll be able to all go to thrift stores, but I went before COVID and I bought these little belts with the loops around them for 50 cents. And I use them to put around my yoga mats. And then when I teach a class, I'll stretch out the strap and have the yoga mat there. So they're really good if you can't get a whole stretch in without, like you can't reach your toe, you can use a strap. And these little belts like this are a very inexpensive way to help yourself get a good stretch in. So what I'm trying to tell all of you is that you don't need to spend money to practice yoga. It's totally free, and yogis throughout the centuries have always practiced it, and they never spent a lot of money on fancy clothes or equipment or anything. So practice yoga, be straight, sit straight, and then be flexible. And as, oh, where did he go? My friend Anne, who is not watching this class because it's at a bad time for her, says, be bendy, just like Gumby. So Gumby is the way you want to think about this. So we're going to do a couple stretches for your neck, your shoulders, and your hips today. Find a place that you can sit straight. It can be a chair or it can be on the floor. We're going to roll our shoulders back, put our hands on our knees. So if you're in a chair, that's fine. If you're on the floor, that's good too. And we're going to roll our shoulders up to our ears, pull them all the way back, and then push them down toward the floor, and then bring them forward. So one more time, up to the ears, all the way back, down to the ground, and then all the way forward. This time we're going to go the other direction, all the way back, up to the ears, all the way forward, and then down. Sitting as straight as you can, we're going to bring the left shoulder up, and the right hand comes down, and then switch. Tuck your chin right here as close to your neck as you possibly can, and then do it again. Up and up. Take your hands behind you. The direction is not important, just so they're behind you. And then roll your head back, and your shoulders make a nice little pouch there. That's where you want your head to fall. Just let it fall back there, looking up into the sky or the room. And if you're real adventuresome, you can go down on your elbows and still get that same stretch. So keeping the neck nice and flexible is very important. We're going to take our left hands, wrap it around our head, tip your head into your shoulder, and then just gently pull. So it's not a tweak, it's a gentle pull. One more breath here, and then take your hand and put it on the back of your head. Look down into your armpit. One more breath here. Then take the back of your palm, put it on your cheek, and just gently push back. And switch. We'll do the other side. Wrap around, gently fall in. One more breath. Back of the head. Gaze into the armpit. Back of the palm to the face, and then just gently push back. Sometimes that feels so fabulous. So take your left hand, stretch it out in front of you, take the right hand, cover it, and then just gently pull back. And switch. Of course, you can hold these longer when you're not on a clock. We're on a clock here. We can only do so much in this amount of time. And then switch. And then there's the old familiar where you take your arm, you cross across your chest, you take the other arm, wrap it around it, and then just pull back. Sometimes this feels so fabulous when you've been sitting still in front of a computer. One more breath, and then switch to the other side. One more breath. And then there's the old familiar where you come up in the air and grab the elbow and pull down. Everybody knows that, so I don't have to really demonstrate that. I'm going to move the computer a bit so I can show you some hip stretches. And Tom, I swear, Tom and I are on the same page every time we do one of these classes. So this stretch, we're going to come all the way back down to your back. You're going to put your right leg over the left, reach through the triangle, and then just gently pull your leg in. So the goal on this one is to get any tightness that you can by gently pulling the knee closer and closer and closer to your chest. So I'm one of those tight IT band persons, and then switch and do the other side. This one just always makes me happy. The other way to do this pose, and some people really like it better because it puts your body weight onto the joint, is to put your leg in front of you. The angle depends on your hip flexibility. So you want to trust your body. It'll tell you when it's the right angle. And then starting with your hands up in front of you, you slowly lower down and your toe is stretched out behind you. Come to the elbows first and see how you feel. Now, if that feels good to you, you can stay right there. If you have more flexibility, you just keep extending and extending until you're all the way down. And then, of course, you switch and do the other side. Yogis are traditionally very flexible people, but not everybody has the same flexibility. So when you do this one, which we call butterfly, you put the soles of your feet together, and the distance here to here is individual, and it kind of depends on your anatomy and how stretchy you are, and if you were silly and rode your bike in the hot day yesterday and made yourself all nice and tight, or you did something else. So we put our hands right on the ankles, lean our chest forward as far as you comfortably can, and then just slowly lower down. So you are looking for an awkward feeling, that's where you stop. You don't push into pain, because all of us know what pain is, and you don't practice yoga to feel pain. You practice yoga to unite your body, mind, and spirit in good health, and pain should not be a part of that. So the goal of this is to get your hips and your knees to expand themselves and just relax. Then I put my fingers right at the ends of my heels, extend forward about 4 inches, come forward and reach again. And if you're really conscious, you'll notice that this is hitting a different part of the muscles structure, and I'm not an anatomy person, so I can't describe it very well, but it gets different parts. So we do both of those. The last one is a pretty intense one, but we're going to do that from standing up. So you stand up as straight as you can, and you're going to cross right over left, and then exhale and come down. And inhale up, switch the other side, and come down. So there's always a micro bend in your knees. They're not locked. This is not the kind of yoga we're doing. Our knees are not locked. They're nice and relaxed. And then you reach down to the degree you can. Some of us can collapse all the way down, and so our head is right on our knees, and others of us don't have that flexibility. So those are my favorites. There's always more. I hope that when the YMCA opens up, that everybody will come to a class there. And we're doing some wonderful yoga classes at CMH. I'm thinking we're going to have to start in the fall soon, and I hope that you'll attend them. But there's great yoga on YouTube. There's great yoga videos you can get, and you don't really have to spend any money to be healthy and do yoga. I'd like to close by saying thank you to everybody. Remember, you are well, you are strong, you are amazing. It's been so much fun to do this with Noelle and Tom and the Y and the CMH. I appreciate the support, and thank you very much. Who's going to speak now?
Jen just shared a couple apps in the comments if anyone wants a hydration app.
All right.
They have water bottles now that mark along the side, so you can see if you're getting enough, and it marks it by time, so you know by like noon you need to drink XYZ amount. So that could be helpful if you're struggling.
Any other questions?
I heard that.
Yeah, go ahead.
Oh, me? Okay.
Yeah.
I heard that foam rolling on your lower back is kind of dangerous. Has anyone else heard that the lower back can be vulnerable to injury from rolling that?
Any part,
Or Tom?
any part of your back can be. That's why I really stress out a lot on, you know, how much you're doing on your back on that. I don't like to go a ton on the lower back. You know, I know what I can do for myself. I know what my clients are. A lot of us with having lower back issues, we want to watch that, you know, we want to strengthen that first too. So, with clients, I know what they can do. So I trust what I do, you know, with them. But yeah, with the lower back, you gotta be really careful.
Okay. Thanks.
I have a question too. Tom, in that first stretch that you did, were you using the weight of the one foot on the other one when you were rolling it?
Yep. Yes, I was using that to add a little bit more weight on that, because a lot of times for me, just doing one calf at a time, like without putting that extra weight on, for me, I don't necessarily feel it. A lot of people will feel that. And over time, as you get that, you know, the knots worked out a little bit more. If you want to dig down a little bit deeper, you can add that extra foot on top of that. Or you can use one like a lacrosse ball, which will really pinpoint deeper into that calf or any muscle part too. But yeah, I do with one foot over the top of the other just to add a little bit more weight so I can dig down deep. Because for me, I get massages monthly, whether I need them or not, just to help me with the stress. And you know, it's being preventive. You got to keep your body in. Even though I roll out all the time, I get massages constantly once a month. It hasn't been for the last 2 months, and I'm feeling it. But
Yeah.
when that opens up, I'll love it. But yeah, it's I do that every so often with you know, like the lacrosse ball, or adding extra pressure onto the calf.
The other thing I used to tell my runners was to take a plastic water bottle and freeze it. And once it's frozen, pull it out of the freezer, and you can roll with that, and then you get the cool ice effect on the inflamed muscles too.
Right. Yeah, another good
That's
one. Yeah.
cheap.
Yeah,
Another
it
cheap one.
definitely is.
Anyone else? I tried the strawberry basil water. With a
What
lot
do
of
you think?
basil flavor right now. I need to give the strawberry a little time to catch up. So I'm not sure yet. Maybe. It's a little strange.
Yeah.
The rest are pretty good though.
Is sparkling water okay?
Sparkling is, yep. You want to make sure you don't have a lot of chemicals, a lot of those, I'm trying to think of the word. I can't think of it. Like sugar alcohols you don't want to do.
Right,
But if it's like the bubbly waters with just a little bit of natural flavoring and carbonation, those are absolutely fine, yeah. And those definitely count towards hydration goals.
Okay.
And Shannon just asked Noelle, do you have to use organic fruit, or will the chemicals leach into the water?
Yeah, it can be better if you use organic. I don't worry about it too much, and I don't really coach people to worry about it, but you do want to make sure you wash your fruit and the leaves that you're using, if you're using like mint or basil, before you add it into the water, to try to reduce that as much as possible. That's a good question. Yeah, and you always want to wash, even if you're using lemon or lime, you definitely want to make sure you wash the outer layer, because as soon as you cut into it, whatever's on the outer layer is going to go into the fruit from the knife.
And one other thing too with that, Noelle, like so many of our clients drink lemonade or stuff that's got tons of sugar that's horrible for us, and they can't drink regular water. And so we always, as trainers, tell them, put some fruit with it. It's cheap. It's a lot healthier.
Yes.
So yeah, it
can be cheap. Or even if you're going to drink lemonade or something, at least make it half water, or even hopefully like 3/4 water, 1/4 lemonade, just to make it a little bit lighter. Lush. Hi, Shannon. Yeah, okay. Oh, so that was Shannon's question. I get it. All right. Hopefully that helped you, Shannon.
All righty. Well, thank you, everybody.
Thank you.
Yes.
Thanks.
I hope to see you all live soon.
Yes. All right. Thanks, guys.
Have a great day.
You
Hey, see you,
too.
everyone.
Thank
Yeah.
you.